Microbiotec is a startup company which was founded in 2009 and essentially is based on technologies and innovative projects that are coming from the University of Siena. Our role in MOTIF is essentially a technical role in which we contribute to setting up and studying the gene expression experiments. In general, MOTIF, in general, our company is interested in developing products and diagnostics for infections of the female genital tract. So we put into MOTIF our experience in modeling the vaginal environment. This we do both in vitro and in vivo in animal models, especially with a lot of emphasis on the role of the microbial communities that inhabit the environment. So there are all the microbes in the vaginal environment are extremely involved in the interactions that are important for successful local therapy. In general, there are infections that are hard to treat by the systemic route. That is true both for drug therapies but also immunotherapies. Essentially, there are infections that are at the mucosal level, are in a sanctuary with respect to local systemic therapy. So I think that there is a big space which is largely unexplored for local therapy in many infections. HIV is certainly one of them, but also the HIV field, but also other fields, and our company is especially interested in infections on the female genital tract. So, and on the local therapy of it. The innovative part is certainly based on specific technologies and specific experience in a very specific field. So we've been engaged in this type of research for over a decade, and actually, unfortunately, a couple of decades. So we bring there a specific knowledge which is not, and then large companies are really very they're a bit suspicious about how big will be the market for local therapy. They are all for systemic therapies and very, very general approaches to that. But think about simple problems like Candida. So vaginal infection by Candida are by no means solved by systemic therapy, even if it's very used, and there is a lot of money being spent on that. And the local therapy is always seen as an aid to it, to a therapy, and so something that doesn't really work very well. Now, there is very little science behind local therapies the way they've been done until now, because very little science has been applied to this field. So we need, and MOTIF is an example where you really try to make some specific discoveries and come up with innovative approaches using new criteria based on scientific evidence rather than based on general, very generic thinking. So the idea it's behind a therapeutic strategy at a local level. What do we have? Actual data, or less than that. So I think the field needs a lot of attention, and the microbicide field bring to this approach this attention, thanks also to the need to develop effective tools against AIDS and the infection from HIV. But it's a field that needs attention because we have a lot of infections that need to be tackled at the microscope level, and little evidence is behind how we could do it.